if somebody has COVID despite being vaccinated, does he have a possibility of developing long COVID or much less?
Yes, that's a really good question. There are some really preliminary small studies indicating that the answer is yes, but the risk is lower if you are a breakthrough case. So after double vaccination, developing COVID. So it happens, it seems, but the risk is lower. But obviously, the main point is that the risk of actually getting infected is also lower, as halved by being double vaccinated. So if you don't get COVID, then you don't get long COVID. So there's a double layer of reducing the risk of long COVID with vaccination. But we need follow-up to see what that means. I mean, people who are doubly vaccinated and who are not really recovering quickly, we need to see how that compares to the people who are not vaccinated and developing long COVID.
Thank you.
Thank you.
Good to know.
I don't see any hands raised. Then I ask one question myself. A parallel question. There is a lot of people talking about long-time effects, not of COVID, but of vaccines. Can you tell us something about that?
Well, we have no evidence of that. I mean, that's the thing when you talk about long COVID. So now, for example, you know, in the UK, we have massive infection rates of school age children. And we always try and raise and say, well, you know, there are these long-term health effects that we don't know in children. People come by and say, well, what about vaccines? But it's not the same, because with viruses, first, we know with COVID, you know, that there is long COVID. We have the experience so far of, you know, just under 2 years of people getting infected. So we know it's not a benign virus in terms of long-term effect. We know it happens with other viruses as well. You know, these long-term health effects, but actually we don't have history, or, you know, we don't have that knowledge about vaccines. You know, people have a lot of fears about vaccine, but we haven't got kind of from our medical history and knowledge, you know, similar examples where, you know, many years later, you would have some sort of adverse effect of vaccine. So it's not in the same, you know, definitely I would say the risks of the long-term risks of the virus definitely would outweigh any hypothetical long-term effects of vaccine. Obviously, there's some side effects that we, you know, rare side effects that need to be considered, but I see the benefits of vaccine very, very straightforward here.
Antonio, the second question.
Yeah, sorry, follow up. Is there any other example of vaccine with a long-term consequence? Or there is no example of vaccine where you have long-term consequence? Possible.
I can't think of any example.
So this would be the first time ever that a vaccine could have some effect, if there is any proof.
Yeah, but so we there's nothing to build on, and maybe other colleagues might answer this question as well later in the panel, but I can't think of any example to kind of have fears around that, as opposed to the real knowledge that we have about the long-term effect of COVID and, you know, for other viruses as well.
Well, it seems that the only long-term effect that is sure is that less people will die, which seems to be a good effect. Alexander.
Yes. Okay. Professor, can you describe the whole effects on the public health systems in context of so large scale of long COVID victims? Because it seems that it will be the major problem for our public health systems, and that means for the whole economy also. So it's a terrible, really terrible, I'm sorry, it's not my maternal language. Okay, It's my question.
Well, I completely agree with you. There are huge implications for the healthcare system. I mean, healthcare now, people trying to seek care, and there is, you know, all sorts of barriers against that because the knowledge is not there yet, but also the capacity is not there. So healthcare costs of chronic illness, and even if we say the majority of people, oh, you know, they will recover, you know, the majority of them will eventually recover, you know, most people might recover, but still, I mean, if they need care within 1 year, 2 years, 3 years, with these vast numbers, you know, when the infection is allowed to kind of spread uncontrollably, it's massive. Like you said, it's not just healthcare, it's about people going back. I mean, we're seeing here in the UK, it's that, you know, people are not being able to go back to their normal working patterns. You know, this illness fluctuates, it comes and goes, people come back and then go off sick and then can't work full hours and all sorts of implications. And also children. I mean, now it's the effect on the education is, you know, something that needs to be factored in, you know, how, you know, if a child has, you know, some prolonged illness or symptoms. I mean, we talk a lot about how the measures in the pandemic affected children, but actually we need to talk about, you know, if the children don't go back to their normal health, what does that mean in terms of education, in terms of their social interaction, in terms of isolation as well, because they've, you know, they can't do the things they used to do, you know, a couple of months ago. So all of these things need to be considered, and there's very little really attention that I see even now to these issues.
Finish, please.
So the UK has set up many long COVID treatment centers. Can you talk to us a little bit about how that's worked, how effective that is in the UK, and what else is needed to understand how good of a model that is for other countries?
Yeah, I mean, I think it is a natural experiment, I guess. I mean, the UK has set up these long COVID clinics. You first have to get referred to them, and that's going through your primary care, so your GP.
Hey,
and
no more Europa.
Sorry?
Oh, no, I speak with
So yeah, you have to go through your GP, then you get referred to the long COVID clinic. They have variable waiting times, but also the clinics themselves are variable in terms of their capacity. There's not much extra capacity going into them. So some of them, you know, you have the face-to-face assessment, you know, multidisciplinary care, and some of them might be more virtual assessment, and they vary in terms of the care. So I think this is the research that's ongoing really in the UK. And I'm involved in some of it in terms of looking at, you know, the models of care for long COVID. But I think it's really important that although we could say, and maybe that's a conclusion that could be made all over Europe, that, you know, there might not be enough capacity to deal with everybody. It's important to actually deal with people who need the care the most. Because what happens is we get this inverse care load. People who need it the most, like we've seen with COVID inequalities, people from more disadvantaged backgrounds, you know, more from ethnic minorities, are less likely to seek care or be offered care and support and recognition. And you have this inverse care law where, you know, the people in need are not receiving care. So how can we, if we don't have enough capacity, how can we make sure that people most in need, you know, are on top of the, you know, kind of the list of receiving care? And that's quite a big challenge with long COVID, because a lot of the recognition depends on how the patient advocate from themselves, you know, in terms, because, you know, the system may not recognize it.
Thank you. There are other questions. It would be very interesting to go on, but, you know, time goes and we cannot help it. And we must move on with our discussion. Thank you again.
Thank you.